नमस्ते आदरणीय व्यक्तित्वहरू। आज चाहिँ म कन्सेप्ट अफ हेल्थ एन्ड डिजिजको बारेमा चाहिँ वाचन गर्न गइरहेको छु। WHO definition of health. WHO 1948 definition of health. Health is a state of complete physical, mental and social well-being and not merely an absence of disease or infirmity and an ability to lead a socially and economically productive life. Is an idealistic goal rather than a realistic proposition. It doesn't regard health as a dynamic concept but is a state. Standard of living. Standard of living refer to the usual scale of our expenditure, goods we consume and service we enjoy. Standard of living WHO includes income and occupation, standard of housing, sanitation and nutrition, level of provision of health, education and recreation and other services. Standard of living depends on per capita GNP. Human Development Index. Human Development Index value range 0 to +1. Human Development Index is a composite index comprising of 3 dimensions: knowledge, income, longevity. In short, we can say KIL, knowledge, income and longevity. As of March 2024, Nepal Human Development Index HDI was 0.601, which placed it in the medium human development category. Physical Quality Life Index component. Component of Physical Quality Life Index are life expectancy at 1 year of age, life expectancy 1, infant mortality rate, literacy rate range 0 to 100, multidimensional poverty index, international measure of acute poverty covering over 100 developing countries. Multidimensional poverty index has replaced human poverty index. Multidimensional poverty index is not over dependent on income per capita. Multidimensional poverty index uses 3 dimensions measured using 10 indicator dimensions: health, education and standard of living. Indicator: health, nutrition, child mortality, education, year of schooling, school attendance, standard of living, cooling fuel, sanitation, drinking water, electricity, housing, assets. Range of multidimensional poverty index is from 0 to +1. Interpretation of multidimensional poverty index: poor if deprivation in more than 1/3 of indicator, 20 to 33 vulnerable to poverty, more than 33% poverty and more than 50% severe poverty. In 2019, 17.4% of Nepalis are multidimensionally poor, just under 5 million people or person, and the multidimensional poverty index is 0.074. Across indicator, the highest number of people are depriving in housing material, clean cooking fuel, year of schooling, asset and nutrition. Indicator of health: mortality and morbidity indicator. Mortality indicator are crude death rate, expectation of life, infant mortality rate, child mortality rate, under 5 proportionate mortality rate, maternal mortality rate, proportional mortality rate. Disease specific mortality rate. Morbidity indicator: admission, readmission and discharge rate, duration of hospital stay and spell of sickness. Life expectancy is a positive mortality indicator. Surveillance index. Surveillance index: life expectancy minus duration of disability, bed disability and inability to perform major activities is known as a disability free life expectancy. Disability adjusted life year: best measure of burden of disease in a defined population and the effectiveness of intervention. It expresses year lost to premature death and year lived with disability adjusted for severity. DALI daily can measure both mortality and disability together. Daily: year of life lost plus year lost to disability. 1 daily is equal to 1 year of healthy life lost. Standard of life expectancy used: Japan life expectancy statistics. Quality adjusted life year. Quality adjusted life year is measure of both quality and quantity of life lived. Quality is year of life lived in perfect health. Quality is used in assessing the value of money of medical intervention. Health adjusted life expectancy (HEL). Equivalent number of years in full health a newborn is expected to live based on current rate of ill health and mortality in a country. HEL has replaced DIL, disability adjusted life expectancy. Socioeconomic indicator mnemonic. Reflect housing, family size, literacy, availability per capita calorie, GNP per capita, growth rate, unemployment rate, and dependency ratio. Case fatality rate. Case fatality rate represents killing power of disease. It is closely related to virulence of organism. Case fatality rate, total number of deaths due to disease divided by total number of cases due to disease into 100. Case fatality rate is proportion, always expressed in percentage. Case fatality rate is complement of survival rate. Thus, case fatality rate is equal to 1 minus survival rate. Disease, rabies, yellow fever, Japanese encephalitis, chickenpox. Case fatality rate, rabies 100%, yellow fever 80%, Japanese encephalitis 30 to 50, 35%, and chickenpox less than 1%. Limitation of case fatality rate. Time interval is not specified. Usefulness is limited for chronic diseases. Case fatality rate typically used in acute infection. Case fatality rate for the same disease may vary in different epidemics due to change in agent, host, and environmental factors. Natural history of disease. Iceberg phenomena of disease. Iceberg phenomena of disease in a community may be compared to an iceberg. Floating tips. What physicians see in community clinical cases. Vast submerged portion, hidden mass of disease, latent, inapparent, pre-symptomatic and undiagnosed cases and carrier. Line of demarcation, surface, water surface is between apparent and inapparent infection. Epidemiology is concerned with hidden portion of iceberg, whereas clinician is concerned with the tip of iceberg. Screening is done for hidden portion of iceberg, whereas diagnosis is done for tip of iceberg. Iceberg phenomena of disease is not shown by rabies, tetanus, measles, and rubella. We can see iceberg phenomena where we can see the upper visible cases and lower hidden cases. Pre-pathogenous phase of diseases. Its period before onset of disease in man at risk. Epidemiological threat. Interaction between agent, host, and environment. Primary level of prevention is possible. Pathogenesis phase of disease begins with entry of organism in susceptible host, multiplication of organism, disease initiation and progression. Final outcome may be recovery, disability, or death. The host may become a clinical case, subclinical case, or carrier. Secondary and tertiary level of prevention are possible. Screening of disease may improve prognosis and increase survival. Control of diseases. Surveillance is ongoing systematic collection and analysis of data and the provision of information which lead to action being taken to prevent and control a disease, usually one of an infectious nature. Passive surveillance. Data is itself reported to the health system. Example, a patient with fever coming on his own to primary health care, CHC, dispensary, private practitioner, hospital is example of passive surveillance. Active surveillance. Health systems seek out actively the collection of data, that is goes out to community to collect data. Example, health worker goes house to house every fortnight to detect fever cases, collect blood slide for various organism program. Sentinel surveillance, monitoring of rate of occurrence of specific condition to assess the stability or change in health level of population. It is also the study of disease rate in a specific population to estimate trend in larger population. Example, use of health practitioner to monitor trend of health event in a population, help in identifying missing cases, supplementing notifying cases. Sentinel surveillance is done in National AIDS Control Program, wherein STD clinic, A and C clinic are sentinel site to monitor trade. Monitoring versus surveillance. Difference between monitoring and surveillance. Monitoring, performance and analysis of routine measurement aimed at detecting changes in environment or health status of population. One-time linear activity, whereas Surveillance is continuous scrutiny of the factors that determine the occurrence and distribution and other conditions of ill health. Surveillance is continuous cycle. Monitoring no feedback present. Surveillance feedback present. Monitoring stop once disease is eliminated or eradicated. Continuous surveillance continuous even after disease is eliminated and eradicated. Monitoring no inbuilt action component present. Surveillance inbuilt action component present. Monitoring smaller concept. The surveillance is a broader concept. Disease control. Disease control primarily refer to primary and secondary level of prevention. Sequence of disease control include disease control, disease elimination and disease eradication. Concept of disease control of disease. Disease control is reducing the transmission of disease agent to such a low level that it ceases to be a public health problem. It aims at reducing incidence of the disease, duration of the disease, effect of infection, complication, financial burden to the community. Disease elimination is complete interruption of transmission of disease in a defined geographical area, but the causative organism may be persisting in environment. Disease elimination is a geographical term that can be used only for a country or a region. Disease eradication is complete extermination of organism is tearing out by root of a disease, exhibit all or non phenomena. Disease eradication is a global term that can be used only for a whole planet. World has eradicated only one disease till date. Smallpox declared eradicated on 8 May 1980. Next target disease for eradication globally are polio, measles and guinea-worm. Polio 2 virus was declared eradicated on 20 September 2015. Prevention of disease. Level of prevention. Level. Primordial prevention. Phase of disease. Underlying condition lead to causation. Objective minimize hazard to health. Intervention. Exhibit emergence of risk condition. Target total population or selected group. Primary level of prevention. Specific causal factor. Reduce incidence. Person and community food. Total population. Selected group. Secondary. Early stage of diseases. Short in duration. Reduce prevalence. Early detection and prompt intervention. Individual with established disease. Tertiary. Late stage of disease. Reduce no impact of complication. Lessen impact of long-term disease. Disability. Minimizing suffering. Patient. Primordial level of prevention is the prevention of emergence or development of risk factor in country or population group in which they have not yet appeared. Mode of intervention. Individual education, mass education is primary prevention in purest sense. Primordial level is best level of prevention for non-communicable diseases. Primary level of prevention. It is the action taken prior to onset of disease which remove the possibility that a disease will ever occur. Mode of intervention. Health promotion is targeted at strengthening the host through a variety of appropriate intervention. Example: health education, environmental modification, nutrition intervention, lifestyle and behavior changes, and level. Specific protection is targeting the prevention of disease through a specific intervention. Example: contraception, vaccine. Primary level of prevention is applied when risk factors are present but disease had not yet taken place. It signifies intervention in the pre-pathogenesis phase of disease health problem. Secondary level of prevention. It halts the progress of disease at its incipient stage and prevent complication. Mode of intervention. Early diagnosis, detection of disturbance while biochemical, functional and morphological changes are still reversible or prior to occurrence of manifest sign and symptom. Example: sputum smear exam for AFP, PS for MP. Treatment: shorten period of communicability, reduce mortality and prevent occurrence of further cases, secondary cases or any long-term disability. Example: DOTS MDT. Secondary level of prevention is applied when disease has possibly set in. It attempts to erase the disease process, seek unrecognized disease and treat it before irreversibility and reverse communicability of infectious diseases. Nutrition health program can be taken as example for secondary level of prevention. A secondary level of prevention is an imperfect tool in control of transmission of disease. It is more expensive and less effective than primary prevention. It is an important level of prevention for diseases like tuberculosis, leprosy, and STD. Tertiary level of prevention is applied when disease has advanced beyond early stage. It aims to reduce or limit impairment and disabilities, minimize suffering caused by existing departure from good health. Mode of intervention: disability limitation. It prevents the transition of disease from impairment to handicap. Example: physiotherapy in poliomyelitis. Rehabilitation: training and retraining of an individual to the highest possible level of functional ability. It can be medical, vocational, social, and psychological. Example: Crohn's disease in poliomyelitis. Tertiary level of prevention signifies intervention in late pathogenesis phases. Example of level of prevention: a patient with fever and cough more than 3 weeks come to DORS clinic for sputum for ARV. Secondary level of prevention: a child coming to immunization clinic for OPV vaccine specific protection. A village community was given health education to prevent spread of malaria. Health promotion: a class of 5-year-old children is discouraged from adopting harmful lifestyle, smoking, etc. Primordial level of prevention: a child affected with poliomyelitis is given crutches to walk. Rehabilitation. Mode of intervention: tertiary level of prevention: disease impairment, disability, and handicap. It can also be written as DISS, disease impairment, disability, and handicap. Disease: any abnormal condition of an organism that impair function. Impairment: any loss or abnormality of psychological, physiological, or anatomical structure function. Disability: because of impairment, any restriction or inability to perform an activity in a range considered normal for human being. Handicap or disadvantage for a given individual resulting from an impairment, disability that limit, prevent fulfillment of a role considered normal depending on age, sex, social, cultural factor for that individual. For example, handicap or disadvantage for a given individual resulting from an impairment, disability that limit, prevent further fulfillment of role considered normal depending on age, sex, social, cultural factor for that individual. For example, event classification and interpretation. Accident is a disease. Accident classification: disease, impairment function of a person. Loss of food, impairment, loss of anatomical structure in the form of food. Cannot walk, disability. Walking is normal routine daily activity of a human being. Unemployment is a handicap. Loses out his job because he cannot work, so cannot fulfill his role in a society that is earning for his family member. International classification of diseases. 10th revision edition, ICD-10. ICD-10 is an abbreviation for the International Statistical Classification of Disease and Related Health Problem. 10th revision: uniform classification for morbidity and mortality data in old. International standard diagnostic classification for all general epidemiological and health management purposes. ICD-10 came in 1993. It covered disease, illness, and injuries. ICD-10 is arranged in 22 chapters. ICD-10 CM has a 22 chapter. International Classification of Disease, 11th revision, ICD-11, released June 2018. WHO composition 3 volume, 26 chapter. Advantage over ICD-10: reflect current medical terminology and informational needed. Function in digital and electronic health record environment, more comprehensive for use in broader clinical setting and enable greater international comparability with no country specific person. ICD-11 linkage to other data standard. International Classification of Functioning, Disability and Health, ICF. International Classification of Health Intervention, ICSI. Time distribution of disease: short-term fluctuation, long-term fluctuation, and periodic fluctuation. Short-term fluctuation, epidemic. Definition: occurrence of number of cases of disease are clearly in excess of normal expectancy. Normal expectancy is derived by looking at average of number of cases of the disease in previous 3 to 5 years in the geographical area. Normal expectancy is equal to 0. Even one case is considered epidemic. Statistically speaking, epidemic is when number of cases exceeds twice the standard deviation. Occurrence of a new disease in a population is NE is equal to 0. Reoccurrence of a eliminated eradicated disease in the population is NE is equal to 0. A type of epidemic: common source epidemic, single exposure or point source epidemic, continuous or multiple exposure epidemic, propagated epidemic, person to person, arthropod vector, animal reservoir, slow modern epidemic. Periodic fluctuation: seasonal trend is seasonal variation. Fluctuation in occurrence of a disease is due to vector variation, environmental factor, and change in herd immunity. Example: measles, early spring, upper respiratory infection winters, and gastrointestinal infection summer. Cyclic trend is occurrence of a disease in a cycle spread over short period of time, which may be days, week, month, or year. Example: measles every 2 to 3 years, rubella every 6 to 9 years, and influenza pandemic every 10 to 15 years. Long-term fluctuation: secular trend implies change in occurrence of disease, progressive increase or decrease over a long period of time, generally several year or decade. It is consistent tendency to change in a particular direction or a definite movement in one direction. Example: communicable disease, poliomyelitis, diphtheria, pertussis are reducing in past few decades. Non-communicable disease, diabetes, hypertension, obesity are increasing in past few decades. Quick review: health state of complete physical, social, and mental well-being defined by WHO. Epidemiological trait comprise of agent, host, and environment. Extermination of organism is eradication. Missing cases of disease are detected by sentinel surveillance. Routine surveillance is supplemented by sentinel surveillance. Watching with attention, authority, and suspension is surveillance. Ivory tower of disease is large hospital. A child lost his hand, unable to do routine work is called disability. Disease elimination is interruption of transmission from large area. Bhopal gas tragedy is type of epidemic. Single exposure point source epidemic. Millennium Development Goal aim to reduce MMR by 3/4. Limit for a station of birth is 21 days. Only disease which is eradicated worldwide is smallpox. Incubation period is defined is from recipient of infection to clinical feature. Infected person harboring infectious agent without clinical feature is carrier. Line in death certificate representing direct cause of death is line A. IA. Epidemic is Epidemic is a short-term fluctuation. Cyclic trend is shown by measles, rubella, and influenza. HDI compromises knowledge, literacy, and mean year of schooling, income and longevity, life expectancy at birth, physical quality life index, standard for physical quality of life index, PQLI, physical quality life index lies between 0 to 100. Gender in development index is corrected development index is for the gender inequalities. Life expectancy is a type of Doderer indicator. Mortality indicator, positive health indicator. Best indicator of availability, utilization, effectiveness of health services, IMR. Most important health status indicator of a community is infant mortality rate. 1 daily signifies 1 lost year of healthy life. Daily is disability adjusted life year. Daily has been replaced by HALE. Disability free life expectancy is measured by surveillance index. HALE is used to measure health life expectancy. Standardization is most important for age distribution. Denominator in under 5 proportional mortality rate is a total death. Level of prevention: following traditional lifestyle for CST, level of prevention is primordial level. Disability limitation is a type of tertiary level of prevention. Psychotherapy is a level of prevention, secondary level of prevention. Screening of disease is prevention, secondary level of prevention. Health promotion is prevention level, primary level. Preventive action taken prior to onset of disease is primary prevention. Early diagnosis and treatment are the level of prevention, secondary prevention. Heart disease in incipient stage and prevent complication is secondary level of prevention. Prevention of emergence of risk factor is primordial prevention. School health checkup come under secondary level prevention. Immunize a child for measles is primary level specific protection. Level of prevention that include specific protection, primary prevention. Not performing anatomical, physiological, psychological function is impairment. Target group in secondary prevention: individual with established disease. Pasteurization of milk is a type of tartar prevention, primary prevention. ICD-10. ICD-10 classification is for classification of diseases. ICD-10 classification is revised every 10 years. ICD-10 is a multi-axial system. Number of chapter in ICD-10 is 22. Chapter 14 in ICD-10 is related to disease of genitourinary system. कृपया मेरो भिडियोलाई लाइक र सब्सक्राइब गरिदिनु होला। यो चाहिँ हजुरहरुको सामान्य इन्फर्मेसनको लागि अथवा हजुरहरुले कुनै ट्राभल गर्दाखेरि पनि सुनेर चाहिँ आफ्नो नलेज अपडेट गर्न सक्नुहुन्छ, रिभिजन गर्न सक्नुहुन्छ। यहाँहरुलाई कस्तो खालको भिडियो चाहिन्छ पब्लिक हेल्थको स्पेशली प्रिपरेसनका कुराहरुमा त्यसको लागि पनि कमेन्ट गरिदिनु होला। थ्यांक यू सो मच।